The interaction of people with disabilities and law enforcement is a complicated and interesting one that deserves further scrutiny in the conversations around police violence. Violence against citizens at the hands of the police has been a growing epidemic for many years. In 2017, 987 people were shot and killed by the police. This is 24 more people than were shot and killed in 2016. In 2018, as of May 3rd, 476 people have been shot and killed by the police. Again, this is 26 more people than by the same time in 2017. From these numbers, it is clear that the fatal shootings at the hands of the police is a growing epidemic, and that our current efforts to curb the problem are not preventing further violence. Unfortunately, many of the people involved in incidents of police violence are also suffering a mental illness. In 2017, over 230 of the people fatally shot by police had a verified mental illness, totaling almost a quarter. Of those 236 people with a mental illness, almost 200 were not fleeing the scene at the time of the shooting, and 202 who were fatally shot by the police have no body cam footage of the incident. As of May 3rd of this year, 2018, 85 of the people fatally shot by police had a verified mental illness. Of these 85 people, 60 were not fleeing the scene at the time of the shooting, and 75 were fatally shot with no body cam footage of the incident. These statistics are not evenly distributed across the country, with some places having significantly higher numbers of such interactions. In Maine, between 2000 and 2012, 58% of people fatally shot by the police had a verifiable mental illness. These numbers are staggering and, unfortunately, are also not accounting for the whole picture of police violence towards people with disabilities. These numbers do not account for people with physical, intellectual, and other forms of disability beyond mental illness. There are multiple accounts of people who are deaf, people who have autism, and people with physical disabilities being harassed, mistakenly arrested, and fatally shot by the police. The reality for people of color who also have a disability is even worse, and similar to police shootings of unarmed people of color, there are often no legal repercussions for such unnecessary violence and murder. People with mental illness and disabilities are 7 times more likely to be arrested and are 16 times more likely to be killed in police custody than those without disabilities. Various reasons for this higher rate of arrest include misperceptions by the police and the general public, generally that people with mental illness are quote-unquote more violent than people without, higher rates of homelessness, higher rates of substance abuse, inadequate police training, and inadequate community support. Each of these reasons can be examined through the lenses of the various models of disability. The biomedical model of disability places people into categories based on their impairment, and often reduces such people down to their impairment alone. This is evident in attitudes towards people with disabilities in encounters with the police, as well as in the media coverage that tends to perpetuate these stigmatizing perceptions. In media coverage of such instances, a victim's disability is used to either evoke pity or sympathy for the victim, or as a justification to blame the victims for their own deaths. The biomedical model takes the role of society out of the equation, helping to absolve the police force of any responsibility to accommodate the victim's quote-unquote individual flaw or tragedy. Thus, higher rates of homelessness, substance abuse, and violence are only due to the individual's own impairment and is not related to societal barriers. The functional and environmental models of disability acknowledge that societal and environmental traits can exaggerate or even create disabilities, and that impairment alone does not equal disability in every context. For example, Magdiel Sanchez, a young man who was deaf and had an intellectual disability, was shot and killed by the police on his front porch in September of 2017. He had not committed any crime, and the police approached his house because his father had been involved in a hit and run. Sanchez could not hear the officers' commands, and it was too dark out for him to read their lips or try to communicate with them non-verbally. The police claimed they did not hear neighbors calling out to tell them that Sanchez was deaf. The police viewed this inability to hear them as non-compliance, and Sanchez was fatally shot. Sanchez's impairment, not being able to hear, was, in this environment, a functional disability. Had it been light out, had the police officers known how to speak American Sign Language, or had they been attuned to the varying needs of people that they are interacting with, his inability to hear their commands need not have been fatal. The social model of disability views people with disabilities as a subjugated minority group in society. Disability in this instance is, similar to the environmental model, not innate within a person with an impairment, but rather created by that person's interaction with their unaccommodating environment. The social model of disability implies that people with disabilities are arrested and fatally shot by the police so often due to the discriminatory attitudes of society towards their community. Given this information, how should police handle situations with people with disabilities? The Americans with Disabilities Act, enacted in 1990, has been the most comprehensive legislation enacted in the United States to protect people with disabilities from discrimination. It specifically outlines the areas in which the law applies, including employment, public services that state and local governments, departments, and agencies provide, all public accommodations, including certain private entities that operate public services, and all telecommunications. Out of the areas that the ADA covers, Title II has been cited as most relevant to police encounters. It states that no qualified individual with a disability shall, by reason of such disability, be excluded from participation in or be denied the benefits of the services, programs, or activities of a public entity, or be subjected to discrimination by any such entity. In these cases, discrimination by a public entity tends to mean the lack of reasonable accommodation for the person with a disability during arrest. Yet there are conflicting and nuanced opinions on what a reasonable accommodation looks like, especially for someone who is exhibiting violence. People with mental disabilities are entitled to reasonable accommodations during arrest only if the ADA, and more specifically Title II, applies to the police officer's conduct during arrest, and many circuit courts have different opinions on whether this is true. Title II of the ADA is what is most frequently used as the basis of lawsuits against police departments and local law enforcement entities. People with disabilities who are mistreated by the police can bring a case to court based on the fact that police departments are a public entity providing a service. Thus, any encounters with law enforcement falls under Title II of the ADA, and people with disabilities are legally protected from discrimination in such encounters. Assuming that Title II does apply in situations of arrest, which it does in many courts, what options do people with disabilities have when they are mistreated by the police? As a broad generalization, there are two theories on which to bring a Title II complaint against law enforcement: wrongful arrest theory and the reasonable accommodation theory. Wrongful arrest theory is applicable when the police inaccurately perceive someone's activity as illegal, when it is really just a manifestation of their impairment. For example, going back to Magdiel Sanchez, his inability to hear the officer's commands was inaccurately perceived as noncompliance. In this instance, he was not committing any crime, but it appeared as such to the officers due to his impairment. Another example is of the court case Jackson v. Town of Sanford, in which the police arrested a man for driving under the influence due to his slurred words and unsteady gait. In reality, Mr. Jackson had previously suffered a stroke which, while it impaired his ability to walk in a straight line, did not impair his ability to drive. On the other hand, reasonable accommodation theory is relevant when the person with the disability is actually engaging in an illegal act, yet the police officers do not provide modifications or accommodations for that person during the course of their interaction. This lack of accommodation must, quote-unquote, cause the person to suffer greater injury or indignity than other arrestees. Arguing a case based on reasonable accommodation theory is more nuanced and complicated, and often refers to instances involving mental illness, and involves exceptions based on outside factors and the level of risk to others. Theoretically, police officers and the courts could avoid such claims by being better able to work with people with various disabilities. Unfortunately, there are many barriers that have left law enforcement agencies being reactive to the situation rather than proactively working to prevent such instances. Lack of training, lack of money, lack of oversight, and lack of empathy are all interconnected and contribute to the ongoing violence against people with disabilities by law enforcement. According to The Atlantic, the ADA's effective communication and reasonable accommodation clauses are unfunded mandates. Public and private entities use their own money to fulfill them. There remain many departments without any real resources to back up their policies, so interpreters and translation equipment aren't always available to the people that need them. In response to police violence against people with disabilities, law enforcement, the courts, the media, and the public all demand that there needs to be more training. This is certainly true, although training alone will not be adequate in changing the perceptions that we hold of people with disabilities. Many law enforcement agencies in the country have already established training programs, usually in the wake of a tragedy, including Virginia, Florida, and New York. Additionally, New York City and many other cities have implemented crisis intervention teams, which entails police officers being trained in how to appropriately respond to people in a mental health crisis. Crisis intervention teams can also include a trained social worker or psychologist to respond to calls with the officers and de-escalate a situation. As of now, this training is only focused on mental health crises and people who are emotionally disturbed, which leaves out a large population of people with various disabilities and challenges with law enforcement. Training for law enforcement is vital, but is only one piece of the puzzle. Non-compliance with the police, which is often perceived incorrectly during an interaction with someone with a certain disability, needs to stop being criminalized in and of itself. In addition to non-compliance, police often react with force to any behavior deemed abnormal, which leads to an escalation of the situation. It is also recommended that law enforcement spend time in the community getting to know their constituents, especially people with various disabilities. Being exposed to people in a non-crisis setting is likely to increase awareness and understanding of people's different needs should a crisis emerge. According to Steven Silberman, the Americans with Disabilities Act mandates all kinds of accommodations, but it cannot mandate empathy.